When medication for depression doesn't make you feel better, TMS therapy can help you feel depression-free. TMS therapy is safe, effective, cleared by the FDA, and covered by many insurances. Continue watching to meet real-life patients of New Hope TMS Therapy who will talk about their experiences of depression and how TMS helped them feel better.
Depression fundamentally is a lack of happiness in one's life. And I think it's probably the worst disease you can ever have, partially because people can never see it like on an X-ray or on a CAT scan or an MRI. So you never get the physical proof of it.
Going forward, but when my mom passed, the grief just lingered, and it sent me down a very dark hole that I could not crawl out of and could not recover from.
As a mother with depression, you don't have a whole lot to offer your children. So you just make the best of what you have, and sometimes that means letting them play in their rooms quietly while you lay on the floor and stare into space. And that's about all you can offer for that day. Or it may mean going outside and letting them play at the park, but they're begging you to push them on the swing, but you really have no desire to push them on the swing.
In terms of family, the biggest thing that happens with depression is withdrawal. The last thing you want to do is deal with people. I would spend so much of my time, energy, and effort putting on a happy face that basically by the time that I got home, I didn't feel like I had any energy left. So it's like I put on the face for someone this entire day, and then by the time I get home and see my wife, Marty, there wasn't that sense of having any energy left. It was like just basically being wrung out, like a dish rag, and basically grab a bite to eat, watch a little TV, and go to bed.
I took this wonderful test that you take that I dislike to this day, but it's a wonderful test that really breaks your heart open and reveals that ugly, shameful depression that has you bound. And when I took that test, I don't know how long I cried, but in every single question, it was exactly what I had been feeling. And I knew then that it was depression, and I was ready to do whatever it took to get that ugly monster to go away.
So depression is a medical illness just like high blood pressure or diabetes. It is a physical problem in the brain, the end result of which is not enough flowing of serotonin, norepinephrine, and dopamine. These are the chemicals in the brain that are responsible for mood. And for people with severe major depressive disorder, those neurotransmitters are not flowing, they're not doing their job. So it doesn't matter how you got to depression, the end result is physically the same in the brain. That is a physical disease, and the reason they can't get over the sadness is because of those neurotransmitters not firing correctly in the brain. So I spend a lot of time in my practice becoming very good at treating depression with medication, which is the usual first-line therapy for the treatment of depression. But I had many patients who, no matter what I did, no matter what medicine we tried, no matter what type of psychotherapy we referred them to, they just didn't get better. And the side effects made them feel worse. Many of the side effects of medications actually mimic the symptoms of depression. So it's hard to know, is the depression getting better, but the side effects are horrible? Either way, they feel horrible. So as a physician, the most frustrating thing is to not be able to help people get better and achieve the kind of quality of life that they want to have. So I started looking around for alternatives to medication for depression, and I discovered TMS, transcranial magnetic stimulation. So I was able to bring it into my practice, and I started seeing amazing results. People who had been suffering their entire life, all of a sudden being able to live life and enjoy their family and be the mom they want to be and be the spouse they want to be the employee they want to be. Transcranial magnetic stimulation. What that means is a magnetic field. We use a magnet that's like an MRI, and that magnetic field goes through the skull into the brain. And it causes the neurons within that section of the magnetic field to fire their serotonin, norepinephrine, and dopamine like they're supposed to.
When you're in that situation and you've gone through so many of these trials and things have never really worked all that well for you, or the solutions didn't last, you get to a point of just being totally discouraged and saying, why should I even get my hopes up that something could actually work?
I decided to choose TMS treatment after years of dealing with depression and dozens and dozens of antidepressants that I tried, and most were not very successful.
I went through many drugs. I went through many hours of counseling and therapy sessions and talking to people. It actually made me feel worse.
The treatment is not painful. It is a very short treatment. The staff was wonderful. You watch movies. I mean, it's the easiest thing I've ever done.
So at New Hope, we've tried to create an environment that's very welcoming, it's very warm, it doesn't feel like a doctor's office or a dentist's office. When you arrive for your treatment, you'll pick out a movie, we give you earphones, you plug them into our sound system, and you just lay back in the chair and let the magnet do its job, hang out and watch a movie.
You know, you're talking about a non-drug therapy. You're talking about something that's non-invasive in nature.
So people often want to know what treatment is like. Our brains have never been touched by anything before, so a magnetic field is touching the brain. It's an odd sensation. Some people have described it as like bubble wrap popping, or other people describe it as a tapping sensation. So you can imagine that after a 37-minute treatment of a pattern of tapping, it's not continuous, 4 seconds on, 26 seconds off, but after 37 minutes of that, your scalp might be a little bit sore. So we tell our patients, you know, when you brush your hair, comb your hair, your scalp might feel a little bit sore for the first couple of days of treatment.
My kids didn't even know I was having treatment, and they said, something's different about you. Something is different about you. And whatever it is, we like it.
It wasn't like a light bulb went off. I didn't wake up one morning and just feel like I wasn't depressed anymore. It was a very gradual feeling, almost to the point where I really didn't notice at first. My husband was the one that pointed it out to me at first. In the course of the TMS treatment, I went back for a follow-up, and my doctor was asking me how everything was going, and I was reporting to her that obviously it's working, because the other day I was taking a shower and my husband came around the corner and kind of peeked in the bathroom, and I just looked at him like, yes, can I help you? And he said, was that you humming in the shower? And I was thinking, yeah, I guess so. I'm the only person in here. And he said, oh, okay, I just don't normally hear you humming. And so I didn't even realize at the time that it was me humming, because depressed people don't hum, you know? So it was really exciting to me that I actually was humming, and I had no idea I was doing it.
Dr. Hart said, okay, but in the middle, you know, you may have a slump dysentery. It happened, it's recorded, so just expect it. And boy, did I. I really hit a low mid-treatment, but it only lasted for a couple of days. And after that, I felt wonderful. In fact, you know, I think it's common, but towards the end of treatment, you're feeling so good, you're like, yeah, I don't need the last few treatments, but you do.
Now, depression is a chronic illness. It may come back in the future. But what's really exciting about TMS is that if TMS has worked for you once, it is very, very likely to work for you again. So it becomes your treatment of choice for depression should it ever come back in the future.
Now that I've had TMS treatment, it's much easier for me to wake up in the morning. I actually look forward to when my children come home from school. And not only that, but my children don't see me sleeping or taking naps nearly as much as they used to. And they really get excited when I suggest that we go and do things. Something as simple as just getting out of my house and walking on the waterway makes such a huge difference to me now.
I used to live my life totally within a level of black and white. And now I live in a world of Kodachrome where I can see all the different colors. I can see joy, I can see sadness, I can see ecstasy, I can see pain. But I can see all of those things. And it gives me the opportunity to actually live my life for the first time.
I have been in remission for 2 years on TMS. And I probably had depression for 55 years. I wake up joyful. I go to bed joyful. I have normal emotions. I still have the normal irritation and, teenagers, you have irritation, but the black hole is gone. There is no black hole. It's not been in my life for 2 years. I say, if you're hesitating, don't hesitate. Call right now. It's your life and it matters.
The most important thing I can tell you if you or a loved one is suffering from depression is to call us. Our consultations are completely free. And during that time in the consultation, we will go over your medical history. We'll go over your story with depression. We'll learn what's worked for you, what hasn't worked for you. We'll need a list of your medicines that you've tried and that haven't worked or that have caused side effects. And we'll help you determine if TMS is the right therapy for you, if we think that it can help you. And if we think that it can help you and that you're a good candidate, then we'll help you navigate the insurance world. And we'll check with your insurance, we'll get the appropriate verifications and the appropriate authorizations, and then we'll get you started in treatment.
What I would say to someone who is fearful of making the call me, I'll come get you and take you. There is a treatment that's easier than you can imagine. There are people there to love you through every moment of it. Don't wait. It's the last thing you do. Ask a friend, a family member, reach out to somebody to save your own life.
Do not sit there and say, I just have to live this way. Because you don't. You don't have to live this way anymore.
New Hope TMS Depression Therapy can help you feel depression-free. TMS is safe, effective, cleared by the FDA, and covered by many insurances. Contact us for a free consultation at 281-783-8080 or newhopetms.com.